I'm wondering what you've learnt about the media as a tool in leadership.
Pick your media engagement is probably what I'd say. When you're a clinical leader or medical director, you don't get a choice. And often the engagement with the media is about a story that is a bad news story. So a patient's died, or something's gone wrong, or you've got a doctor or a nurse who's misbehaved. And you've got to be very honest and frank about that, but you've got to try and limit the damage to your organisation, to your team through that. And that's something that you need to learn and to accept that that's part of your process. But actually the media has a much wider role in terms of communication. And for me, I write a lot of scientific papers, research papers, but actually nobody reads them. So it's how we communicate those to the wider media, which is so fundamental. So I'm a great advocate of engaging in partnership with the media, particularly local press. They're the key for most local organisations, but where you get the chance through national media as well to get health messages across, to get research messages across.
Have you learnt anything, or have you got any advice that you could give people about interactions with the media?
Media training is important for all clinicians, because at some point you will have to interact with the media. I think that it's hugely important in communicating healthcare messages, both from sort of disease prevention strategy and sort of public health messages, but also for investigators and clinicians to communicate their research work, to make it meaningful to the people who participate in it. For swim and for any movement, social media is important. On a personal level, I use social media to stay informed, to keep inspired, to follow organisations and individuals, and I think it's hugely beneficial for junior doctors and senior doctors to engage with. I don't use it too much on a personal level, but I certainly read a lot and use it that way. And I've encouraged the leadership fellows we've got now for swim, that using social media such as Facebook for swim is really important, particularly as we're really keen to get the messages out to younger generations, even before medical school. And really the main way we're going to do that is through Facebook. So I would encourage people, again, there's lots of professional courses that exist, to basically get wise about it, use it wisely, and try not to be too scared of it.
And you're an avid user of social media, obviously that's part of the success here. I'm wondering what you've learnt about Twitter and other internet tools, I suppose, as a tool for leadership and for spreading your message.
I came to Twitter quite late to the party, really. It became quite clear that I already had a bit of a fan club out there, that people were already talking about me. And all of a sudden, all these people started following me, and I was like, well, what have I got to say? I had to think very carefully about how I was going to enter this arena that's such a huge arena that anybody could be listening. So I started interacting with people about compassionate care, about how we deliver healthcare and how we change healthcare behaviour, and the things I'd sort of written about in my book, and people started listening and following and interacting, and it just kind of snowballed from there. It's just a very wide arena.